I'm Sarah.
I'm Lauren.
And I'm Riley.
Welcome to the annual board governance training,
which is required according to Head Start regulations.
We will try to make this as painless as possible.
Why are we here?
Well, that's a really good question.
A comprehensive training would require at least 6 to 8 hours.
And a school day only lasts 7 hours, so we have to make this quick.
Buckle up for the ride of your life.
Here are the Head Start standards we've selected and prioritized.
Last year, we focused on eligibility, recruitment, selection, enrollment, and attendance. As a result, the JCPS board established an ERSEA team and approved a new plan for the 2016-17 school year. JCPS early childhood classrooms are now at a 98% capacity and growing.
A one-page monthly report is now provided to the board in their daily updates as a simple way to stay up to date on enrollment, attendance, meals served, the number of students with disabilities, budgets, program management, and comprehensive services.
The annual self-assessment provides Head Start programs with the means to regularly assess their own management systems and program operations. The assessment results are presented to the board for approval in May. Comprehensive service requirements. Physical health Head Start programs work with families and children to understand how to achieve and maintain the best physical health. This means making sure all children have medical and dental providers as well as health insurance, ensuring all students receive hearing and vision screenings, and ensuring all students are up to date on all EPSDT requirements, including physical exams and immunizations.
Nutrition. Students must be provided 2/3 of their daily dietary needs while attending the program. Meals must be provided using a family-style approach, promoting social and oral language development. Oral health. The program must promote effective oral health hygiene by ensuring all children with teeth are assisted in brushing their teeth with fluoride toothpaste. All students must maintain an up-to-date dental exam.
Mental health. Early childhood mental health is closely linked to social and emotional development. Head Start and Early Head Start partners with professionals to ensure children, families, and staff have access to prevention and intervention services. Family engagement and support. Head Start supports not only children, but their parents and/or guardians as well. Staff works with families to set goals based upon their needs and interests. The program provides a variety of family engagement activities to promote the belief that the parent is the child's first teacher.
Shared decision making. The role of parents in decision making is a key feature of Head Start programs. Opportunities to be involved in decision making occurs through parent-center committees at the school level as well as through Policy Council with the Board of Education.
We must provide comprehensive and holistic support to Head Start children and families so that children will be ready for kindergarten. And we know that is not just letter recognition that gets a child ready. Child development and education. This includes providing individualized attention to children so that we meet the needs of all children, including those with disabilities. Working with the families of disabled children is a very important part of the program, and we are required to serve at least 10% of enrolled children with special needs.
Health and safety. If children aren't healthy, they won't be able to learn or participate in school, so it is a critical piece of the Head Start services. Family and community engagement. Family engagement plays a key role in closing the achievement gap. Leadership and governance are the bedrocks of effective management. They encompass and inform 12 management systems. The JCPS Head Start leadership consists of 3 key entities: the Board of Education, Policy Council, and management staff. The Board of Education assumes legal and fiscal responsibility. The Policy Council sets direction, and management staff oversees day-to-day operations.
The yellow circle outlines the scope of these systems consistent with the 5-year project period. The systems support program management, planning, and well-developed oversight systems. This enables programs to comply, increase quality, and strive for excellence.
The blue ring outlines each of the individual management systems. All of these systems work together to influence the program's service delivery, represented in the dark blue circles. This includes eligibility, recruitment, selection, enrollment, and attendance, ERSEA, education, health, mental health, community partnerships, and family engagement. The governing body is responsible for having legal and fiscal responsibilities for administering and overseeing programs including safeguarding of federal funds, adopting practices that assure active, independent, and informed governance of the Head Start agency, and fully participate in the development, planning, and evaluation of the Head Start programs. being responsible for ensuring compliance with federal, state, and local laws.
Universal duties of boards and board members. 1. Duty of care. Exercise good business judgment and the care an ordinary person would exercise under similar circumstances. 2. Duty of loyalty. Carry out duties in good faith and in the best interest of the organization. 3. Duty of obedience. Ensure that the organization stays true to its mission and adheres to the law.
The Head Start Management System visual shows the 12 management systems created to provide a framework for you to understand how to best support children and their families.
There are 3 key roles of the Board of Education. 1. Financial management and reporting. 2. Review and monitoring of kindergarten readiness data. 3. Shared governance.
The Policy Council must approve policies, the self-assessment, and the community assessment. They receive and review the same monthly information provided by the board.
The Policy Council is consulted for hiring and terminations of any employee funded by Head Start. And finally, they help establish the budget for the upcoming year.
Altogether, the Policy Council will have 23 members made up of 1 parent from each of the 5 achievement areas representing early childhood sites, as well as 1 alternate for each area. 6 parents from the centers not presented by an achievement area and 7 community members will serve on the council.
We hope this training wasn't completely boring.
Have a great day.
Bye!